The following is a special presentation from Renda Broadcasting of Indiana and News Talk 1160 WCCS. IRMC Today, an inside look at your community hospital. IRMC Today is heard every Saturday from 7:30 to 8 a.m. and again from 12:30 to 1 p.m. here on News Talk 1160 WCCS. We have Dr. Howard Miller with us again today from COSM, and we were discussing how long it's been since you've been here. Something else that has happened since you were here last. We now have an FM station you're on as well, 101.1 FM.
Oh, fantastic.
So we're being heard on two radio stations during this show today. But you had mentioned, 2011 maybe is when
I think so.
Human Motion Institute.
Yeah, and I think it's been 2-3 years since I've been in the radio studio. So.
How time flies. Huh?
You look younger. I look older.
I look younger. Now I like you've got a little bit of a beard thing going on there.
My son will do that.
Makes you look sophisticated. So let's talk sophisticated stuff like bunions, okay? First of all, for many folks who, I don't know that people really know exactly what a bunion is. Certainly for people that have never had one, but it's a serious thing, and maybe describe exactly what a bunion is.
Usually the one thing that brings most, people into the office, not always, but is the pain associated with that. And that's why, it's a common problem, and one that can be fixed very easily if it gets to that point. But most times when people think of a bunion, they basically think it's a bump that's occurring on the side of the foot, which is actually incorrect. So what's actually happening is due to faulty mechanics and biomechanics, the great toe joint is actually going out of position. And so as that joint continues to go out of position, it'll protrude. And so what you're actually seeing is the joint out of alignment, and it isn't a bump.
Well, as you just described how bunions occur because of that joint getting out of place, and you're not really seeing a bump, so to speak, there. What causes that? And is it something that is hereditary or not?
Most common, the point that's hereditary is the faulty mechanics or biomechanics that a foot structure would have. You inherit, the bunion is hereditary to the point that the hereditary part is the faulty mechanics,
right,
which
so
then leads to the bunion.
I see.
And there's bunions that develop very early, children that are 8, 9, 10 years old. Most commonly, it occurs later on in life because the mechanics aren't quite as severe, and so it takes time for that to develop. Well,
something that I was thinking, is it does it seem to be more prominent in younger, older people, or doesn't age really matter?
Most commonly in older people, but it can develop in adolescence. Usually, you'll see them in the teenage years that it can start to develop, but definitely most common in the older population.
Or can they get worse? What is the outcome if they're not treated?
Yeah, most definitely. It usually is something that's what we call progressive, meaning that over time it's going to progress and it's going to get worse over time. Now, some people, it can progress very, very quickly, and they may come in for an office visit, and within a year to 2 years, it can develop to the point that it's so painful, something needs to be done for it, or it could be something that over a span of 10 to 15 years. So there's so many variables that go into that. But it definitely usually doesn't stay exactly the same.
Mm-hmm. How are they fixed? Is it something that is outpatient? Can it be done with surgery? Can it be done simply? How do you deal with bunions?
Well, let me just say, on like a first evaluation, or somebody that might have questions more so than having a lot of pain, there's always some simple things as far as altering your shoes, making sure you have a shoe that fits properly. Mm-hmm. There's certain pads and splints that people can use. Most of those are aimed at just trying to reduce the pain that somebody might be having, allow them to get through daily activities. If somebody's able to lead a healthy, active lifestyle, they might play sports, they're able to do all those things, run, play basketball. That type of person at that point isn't the patient that should have bunion surgery. On the other hand, if it's to the point that it's painful, they no longer can exercise, They've tried to alter their shoes. That hasn't helped. And it's really starting to affect what I call their daily activities, and they're having a significant amount of pain. That's now when it becomes a point where we usually discuss surgery, because that's actually going to correct it, because we're going to correct the structure of that joint to alleviate their pain. So it's usually done on it's outpatient. They go home the same day. Usually, not always, it's done with IV sedation and local anesthesia, so they recover very quickly. They usually don't need general anesthesia. The surgery itself usually takes less than an hour. Another common question, usually people can start to walk on it, pretty quickly within a couple days.
What is the recovery time?
Yeah, no, there's always going to be some variation.
Sure.
As far as how much pain one person has as compared to another. But most times from my standpoint, they can start to walk on it in a surgical shoe to protect it. Sometimes with crutches to help, take some of the pressure off, but they're walking within a couple days. Initially, we're just trying to get a lot of the joint or the inflammation and swelling down from the surgery. That will reduce their pain, and we can do that with certain medications and ice and just not overdoing it. The overall healing, because we're dealing with a bone that has to be realigned, and usually that means it's being cut, then put in a better position, and also soft tissue balancing. It's usually about 6 weeks for the bone to heal, which sometimes people hear 6 weeks and think that it's going to be completely healed in 6 weeks. It's then they take some time to get their range of motion back, to make sure the swelling's down. So there's a series of phases. The bone will be healed in 6 weeks. At that point, they should be back to most of their shoes, most daily activities. They're not going to be running and jumping at 6 weeks. That's going to be usually 8 to 12 weeks, so you can run and jump.
Now, because we're dealing with the areas that we are, and you have to put things back in place where they should be, are we dealing with pins and screws and things of that nature, or normally not?
Usually the surgery, the bone has to be cut and realigned, so you want to hold it in place until it's healed, usually with a small screw that would stay in most times, or sometimes pins that sometimes will stay in or sometimes could be removed. Most times now, because it's so specialized, they have very small, low profile screws or occasionally plates that don't have to be removed. Somebody really wouldn't even know that they're in unless they looked at an X-ray or
unless I go to get on the plane.
Correct.
When I go to get on that flight, it's going to set off the security. And how long typically does, and again, this will vary from case to case, but typically how long do they expect to be in surgery?
Less than an hour. Now, there's always, some variation. So you could classify it in terms of just very mild bunion to moderate up to severe. And most commonly, they're mild to moderate. Now, if somebody has a severe bunion, the exact procedure to fix it and address all those issues might require a little bit lengthy surgical time. Also might cause some variation in their recovery time, which would always be explained, before the surgery. If they came to see myself, or if you're seeing another foot and ankle surgeon, they should explain in detail your postoperative recovery and what to expect.
We're talking with Dr. Miller from COSM at Indiana Regional Medical Center at the Human Motion Institute. And where would the surgery take place, Dr. Miller? Would it be at the surgical suites at IRMC, or is this something that's done at the Human Motion Institute itself?
It would be done at the at IRMC, or occasionally it's done at the ambulatory surgery center located right beside it. And usually those things have to do more with somebody's medical history, if they've had any anesthesia problems or anything like that. But it's usually not done in an office setting unless a doctor has a designated surgical suite in their office, which we do not.
Dr. Miller, who hasn't been here for quite some time and longer, don't make it as long next time.
Yeah.
Come on back again.
I've been in Indiana since 1996, which some people even find that hard to believe. But
well, now, if someone wants to learn more, how do they do that? How do they get a hold of you? How do they get a hold of your office?
The office can be contacted at 724-465-2676, and the schedulers will be happy. Sometimes they can answer questions and get you an appointment, whether it's just to discuss. Sometimes I'll go over these very similar conversations like we had in the office on a first visit. There's also literature that they can read through. So,
and don't rely on what your neighbor tells you and your Aunt Isabel tells you and what you find on your own on the internet.
Yeah, there's always going to be some variation.
Find out by giving your office a call and get a professional.
And without an X-ray too. So you have to look at the X-ray, and then the surgeon can usually then explain exactly what would be done to correct it and go over in detail, like I said, the anesthesia, the procedure, the recovery. All those things can be answered.
Well, it's all about bunions and how we can make your bunions feel better, whether it's in need of surgery or there are many other options, as Dr. Miller just said. So it doesn't necessarily have to go down the surgical route, but there's no reason why you should be in pain when it's pain-free is just a phone call away at 465-2676. That is the office number for Dr. Miller over at COSM. And Dr. Miller, we thank you so much for dropping by and being with us.
Thank you for having me.
An innovative facility open 7 days a week providing care for minor illnesses and injuries.
IRMC at Chestnut Ridge, Blairsville. Urgicare.
Walk-ins welcome. No appointment needed.
IRMC at Chestnut Ridge, Blairsville. Urgicare.
Diagnostic testing on-site. Lab testing available. Board-certified physicians.
IRMC at Chestnut Ridge, Blairsville. Urgicare.
How about minor lacerations, minor back pain, abdominal pain, and skin infections, earache, and sore throat?
IRMC at Chestnut Ridge, Blairsville. Urgicare. IRMC at Chestnut Ridge stands apart. Their physicians have all the tools available. CT scan, ultrasound, laboratory, diagnostic x-ray, digital mammography, all on site and available to assist them.
Convenient hours Monday through Friday, 8 to 8, Saturdays and Sundays, 9 to 5.
724-459-1700. 724-459-1700. Get in, get out, get better.
IRMC at Chestnut Ridge Urgicare, Blairsville.
Mark Burdick back with you on IRMC Today, and our guest is physiatrist Dr. Lanvin Taylor II. And Dr. Taylor, welcome to IRMC Today. I know you came to Indiana Regional Medical Center and started your practice in late 2015. Welcome aboard.
Thank you for having me.
Well, I know you're a board-certified physiatrist or physical medicine and rehabilitation physician. So for people like me, what exactly does that mean?
Essentially what it means is that I work on getting people up, getting people moving, getting people physical. You hear a lot of, physiatry, physical medicine and rehabilitation, and it's about, taking someone who may have had some type of insult to their ability to function and getting them back to doing the things that they like to do that make them the whole person.
Tell us about your background, where you grew up, where you went to school. Take us from point A to Point Z, which is your career here in Indiana.
I grew up in Brentwood, Long Island, graduated from Brentwood High School and went to Cornell University. After that, I took some time off. I worked at a hospital in the film library when hospitals used to actually have all of their radiology on films as opposed to on computers. So they needed people to hang the films, put the films away, keep them organized. I was involved in that. And I also worked at a group home for children with developmental disabilities. I did that for about 3 years and realized I wanted to be a doctor and went to medical school. I went to UMDNJ SOM, which is now part of the Rowan system, now known as the Rowan School of Osteopathic Medicine.
New Jersey?
Yes, in New Jersey. After that, I did my physical medicine and rehabilitation residency or physiatry residency at Temple University in Philadelphia.
So it was a long road to Indiana, but a road that you hope will pay dividends. So as you look back on it now, no regrets.
No regrets. And I also had a short stop off in after residency working in Philadelphia at Einstein.
Tell us about the decision to come to a small rural market in Indiana County, Pennsylvania, nestled, I guess, in the Laurel Highlands, 60 miles from Pittsburgh, quite a ways from your hometown.
It was a decision that I gave a good amount of thought to. As I said before, I was working in Philadelphia. I wanted to change the scenery. I wanted to experience some new places. I have, if you in hearing what I was talking about before, I've kind of been all over the place, being in suburban areas, urban areas, more rural areas, and I just felt like I wanted to change, wanted to try something new. And the first job that I had was where I did my residency, so I really wanted to just step out on my own, and I felt like this was a good place to do so.
Did you have options when it came down to a final decision as far as different parts of the country?
Yeah, I had options. I mean, I think you can, as a physician, you pretty much can go anywhere. What attracted me about Indiana is when I talked to Dr. Bush and I met some of the physicians here. It was a place that seemed like there was a real collegial atmosphere, an environment that fostered cooperation and communication amongst the physicians, and it seemed like they were really trying to build something here. And I felt like I could get in and be an integral part of that.
We're talking to Dr. Lanvin Taylor, physical medicine and rehabilitation physician, came to Indiana Regional Medical Center in December of 2015. Dr. Lanvin, I've been told you're a good public speaker, and you've spoken on topics such as stroke and other diseases. Can you tell me more about that?
I can. Can you be a little bit more specific?
Well, I know you've been in some publications. You've given some formal presentations along the way on lymphedema, stroke syndromes, that kind of thing.
Sure. I mean, a lot of that was related to I taught residents. So I had doctors in training, and then physicians that were in training. As part of what we do, we're lifetime learners. So it's always important for us to be keeping current, keeping up to date with the latest in medical technology, medical information, and things like that. So that was what those topics were for. I've done talks on strokes, varying from what we'd call ischemic strokes, where you have a blockage of a blood vessel in one of the arteries of the brain, and to hemorrhagic strokes, where you have bleeding from one of the arteries in the brain, to talking about how one rehabilitates from that and gets back to 100, gets back to being who they were before the stroke, or as close to it as they can, being that father, that that whatever, that job role, that person.
How has your practice grown in the first few months here in Indiana?
It's grown well. I have a number of patients that I see on a somewhat regular basis, being that I've only been here for about 2 months at this point. I see a lot. I also see a lot of musculoskeletal, without getting too scientific-y, which just basically means body and muscle aches and pains, for everything from arthritis to strains, sprains, things like, and automobiles. If I can make a little joke.
Sure. When can we meet? What do you like to do in your spare time? Tell us about your family and some of your hobbies.
In my spare time, I am admittedly a bit of a dork, a bit of a homebody. I'm at an interesting point, I think, in my development as a person. I think when I was a little bit younger, I would feel more like the world was my playground, and I'd like to be, out and about. And I've more developed my home is my castle type of mentality, and feel really comfortable just, being in the house, reading a book, catching up on some Netflix. I'll just say, we could go back to some of those HBO shows like The Sopranos. I'm rewatching that.
Very, very good. Now, if somebody wanted to get in touch with you, how do they go about that?
Well, we have a central call center, and our number there is 1-888-452-IRMC, and that's 4762. So that's 1-888-452-4762.
Well, thanks for visiting with us on IRMC today. I had the opportunity to meet you when they had a welcome event at Benjamin's in early December, I believe that was. That was a lot of fun, and we wish you the best of luck here in Indiana. It's good to have quality doctors like we have. It's great to have a facility like IRMC in our backyard, and I know I don't take it for granted, and many others don't too, but it wouldn't be anything without people like you being on board.
Well, thank you very much.
An innovative facility open 7 days a week providing care for minor illnesses and injuries.
IRMC at Chestnut Ridge, Blairsville. Urgicare.
Walk-ins welcome, no appointment needed.
IRMC at Chestnut Ridge, Blairsville. Urgicare.
Diagnostic testing on-site, lab testing available, board-certified physicians.
IRMC at Chestnut Ridge, Blairsville. Urgicare.
How about minor lacerations, minor back pain, abdominal pain, and skin infections, earache, and sore throat?
IRMC at Chestnut Ridge, Blairsville. Urgicare. IRMC at Chestnut Ridge stands apart. Their physicians have all the tools available. CT scan, ultrasound, laboratory, diagnostic x-ray, digital mammography, all on site and available to assist them.
Convenient hours Monday through Friday, 8 to 8, Saturdays and Sundays, 9 to 5.
724-459-1700. 724-459-1700. Get in, get out, get better.
IRMC at Chestnut Ridge Urgicare, Blairsville.
And welcome back to IRMC Today on News Talk 1160 WCCS. Continuing with our interviews from the hospital each and every week. We like to speak to not only staff members and a lot of employees that have been with the hospital for a long time, but we like to talk to managers and doctors as well, and get to meet a lot of doctors on the show. And I've learned so much about the medical industry and about hospitals that I did not know, especially behind the scenes. And we're about to learn and get educated a little bit more on the lab over at Indiana Regional Medical Center, because we have the lab director, Kelly Yoder. And Kelly, welcome to the program.
Well, thank you very much.
And Kelly, tell us a little bit about where you come from, and you've traveled around. You're from Indiana originally? No, probably, or I don't know really the answer to that. So tell us where you're from and how you wound up here in Indiana.
Okay, well, I live in Ligonier. I'm originally from Clarion County. I've been in this area for, now I have to say over 30 years. And I originally came from Excella Health System, and I came up and applied for a job at Indiana as a lab director as there was a retirement, and luckily I got the job. I'm very happy there.
Well, that's terrific. And you've been here for quite some time now, and enough time that you can tell us how you like Indiana as opposed to where you came from originally. You live in Ligonier, but you're here daily. You're here Monday through Friday? Monday through Friday. So how do you enjoy being here every day, and what are some of the things that you like to do in Indiana County?
Well, I really like Indiana County. It's a hometown community, very much like Clarion County, but a little bit bigger. And I enjoy the shopping and the community and the actually Philadelphia streets. Very nice.
And how about the hospital? We hear so many times by staff members, by doctors, employees at Indiana Regional Medical Center, which has been voted many times best place to work. Do you enjoy working with the employees over there? It's everyone always has a smile on their face.
Yes, I've really enjoyed my time there. I've been there for almost 3 years. The community, I call the IRMC family and community, is a joy to work with. They always put in their best to do well for their patients, and they really care about their patients. And, everybody helps everybody out.
Now, one thing about Indiana Regional Medical Center is that they do a lot of things still at the hospital, even like laundry services, which we don't find at many other hospitals. They not only are the hospitals beginning to form a health system, Indiana Regional Medical Center so far has been lucky that we have our own laundry service and we have our own lab. And many times it's not that way. Personally, myself, I'm not in favor of labs being outside of hospitals. Maybe I'm naive that way, but I just really like to think of having my blood work done and things done all in one place. If I'm dealing with IRMC and dealing with doctors at IRMC, I want to know that my blood has gone to the lab at IRMC. And you are the lab director, and tell us a little bit about IRMC's lab, because it's well run, and you folks do a good job over there.
Yes, well, we try to do as many testing as we can in-house. We've recently brought in a lot of testing, such as Lyme disease, so we can get the turnaround time better for the patients, since that's a very prevalent disease in our area. We work with a reference laboratory, Mayo Clinic, which is highly regarded in case we cannot do the technology to send out specific reference testing. Also, we do as much as we can in-house. We have all the services available. We have microbiology in-house, blood bank, histology, pathology, and we recently brought in cytology for pap smears in-house also. So that has improved our quality and also improved the turnaround time.
Is there anything the lab can't do at IRMC? Is there anything that you do still have to, send outside of the lab?
Yes, there are a lot of highly technical testing now that for cost purposes that we cannot perform because of volume. A lot of genetic tests that are coming out routinely now we have to send out to Mayo laboratories. And also we don't have high volume, so it doesn't warrant the cost of bringing it in.
Yeah, well, that's terrific. I know that, and speaking with Steve Wolf, CEO over at Indiana Regional Medical Center, I know that he and the hospital are very proud that there's so much more that is done on site now, and less reasons for people to travel to Pittsburgh or travel outside of Indiana County for their health care. And we want to talk about something that goes directly to that, and that is the Coumadin Clinic. It makes it so, what I want to say, it's easier now for folks to get blood results from their testing. And maybe tell us a little bit about Coumadin Clinic and how quickly people, what to expect if you go there and how quickly you'll get your results. I know oftentimes we get blood work done. I know in my case, and it's not because my doctor is different than any other doctors, but usually they don't call if everything looks okay. And you're just wondering, what are my results? And you wind up calling, and this can go on for a few days. Coumadin Clinic is a little bit different than that. Maybe tell us about it and how quickly you do get results.
Coumadin Clinic is wonderful for patients that are on Coumadin and warfarin. We actually have a nurse, Cindy Barnes, who works in the Coumadin Clinic. You have an appointment, so you actually have a specific time that you come in. You come in, she'll do a finger stick on you, run it on a little analyzer. She'll connect via internet with a PharmD on the other end. He will adjust your medication real time. She will tell you and send you a nice little printout of exactly when you need to take your medication, how much you need to take, and what days to take it. So it's nice, it's real time. You don't have to worry about getting a venipuncture or waiting in line for, in the lab line. Because you have an appointment. Also, you don't have to worry about having your physician contacting you to tell you how much you need to take or how much not to take in adjusting your medication. So it's a wonderful clinic that we have. It's on site at Indiana Regional Medical Center, right on the first floor. So if you would like to get enrolled in that, please have your physician has to refer you in, since they are the one prescribing the medication, and Cindy Barnes will get you in.
That was my next question. Should you go through your physician? And you should. And you will get these results quickly, and it is just coordinated so nicely. And that's terrific. I think it's moving more and more in that direction now that we are beginning to coordinate with the doctors and the hospitals and the specialists and the pharmacy. And it's wonderful that at the Coumadin Clinic you can get this done now. Does that also involve, has the electronic patient records helped in that area as well, or is this something that has kind of just naturally moved into the direction of what they're doing now at the Coumadin Clinic?
I think it really has moved into this direction for patient convenience. Be able to get your information real time, and it locks into the EMR that we have in the hospital. But I really think it's truly for patient convenience, and it works well. It's standardized, and we have all the good quality control and everything on the analyzer, so you're getting a good quality product with good quality results.
Okay, she is Kelly Yoder, and she is the lab director at Indiana Regional Medical Center. We've really enjoyed talking to you, and if anyone would like to know more about the lab in general, and I know a lot of folks, my wife happens to be involved in a lab, not at IRMC, but with another health facility, and I know that people have a habit sometimes of calling wrong numbers, or they'll just show up. Every once in a while you get someone who walks through the door that shouldn't be there. But if people want to know more about the lab at IRMC, can they call the main number, or how can they do that? I know that you have to have a physician's referral for the Coumadin Clinic, but if you just want to know more about how the lab works in general, can they call just the main number and speak to somebody? Is there someone they can call?
Yes, they can contact the laboratory directly. It's 724-357-7160, and we would be happy to talk to them. And they can ask for me, Kelly Yoder, and we can give them a little information about the laboratory and help to answer their questions.
All right. Thank you so much, Kelly, for being on the program, and maybe have you on the program again in the future.
Okay. Thank you very much. It's been a joy.
You've been listening to IRMC Today on News Talk 1160 WCCS. IRMC Today can be heard every Saturday from 7:30 to 8 a.m. and again at 12:30 to 1 p.m. Join us next week for another edition of IRMC Today, a special presentation produced by Renda Broadcasting of Indiana and News Talk 1160 WCCS, the voice of Indiana County, and your voice of IRMC Today.